Joining us now is Dr. Marcus Green from Age UK. I don't know how you can almost sort of keep your cool and keep your counsel with the work you do with Age UK, because you have been saying this is coming at us like a train charging down a track for so long, and no one seems to be listening or at least prioritising the awful situation he and his wife find himself in.
Absolutely. I mean, you know, even 5 years ago, things were already pretty bad. I mean, there were lots of stories like this we were hearing day to day. We know that there are people with quite serious everyday needs. We're talking about the fundamentals of everyday living, being able to get out of bed, get yourself dressed in the morning and eat and use the toilet. We knew that 5 years ago that this was the situation.
Do you think the government, not to interrupt you, but I just want to try and get to the nub of it. Do you think, I mean, you must want to go and just stand all day and all night and batter on the door of number 10. Do you think the government knows and just can't do anything because the money's not there, and we all have to accept that that awful situation is coming at all of us and our parents and people we love?
I mean, no doubt this is difficult for government, absolutely. I mean, there is a general sort of financial crisis in both the NHS and in social care. But I think we need to be putting more value on the fact that older people who've lived long lives, worked hard, worked for their living, are now in these sort of everyday situations. So really, yes, of course, it is difficult as it currently stands, but we need a very progressive conversation with government openly.
You? Have you rung up and said, listen, people are dying, and you're allowing it to happen on your watch? What are you going to do about it? And do people ignore you? Do they not respond to emails? You know, how does it go? Because we've talked many times.
Yes, we have.
And are they just ignoring the conversations that you're having?
We're certainly getting things coming back to us more and more publicly. So now we're hearing, oh no, there will be new money for social care.
7.6 billion, they're saying, presumably they're looking at merging some of the NHS budget with the social care budget.
This is it.
Yeah.
And the NHS is currently in some crisis as well. The NHS can't give much money to social care in the way it currently is. If the social care system is not properly funded, people therefore have escalating needs and they need to go into hospital, and that's so much more expensive.
What do we need to do? I mean, what is your solution? I mean, do we need to raise taxes? What do we do? Do we all have to start paying more? I mean, we've got inflation coming.
Sure.
I mean, goodness knows who would want to really vote in somebody who said let's raise taxes by that much. But
I mean, there are options for us. I think obviously we can work more efficiently in the health and care system. It's currently very fragmented, and so you have individuals without support at all in their home environment, such as what we see here. But I think there's a lot more to it than that. It does need new money. We can't shirk that. It desperately needs new money, and we're not sure where that's going to come from.
No, that's not going to come.
So, you know, I mean, there are options, I think. I mean, obviously taxation's on the table. There are other options as well.
Like what?
Well, I mean, we're probably down to the situation where we're saying, look, you know, where's the money in all of the bits of the system? Do we need to decommission certain services that are potentially not as valuable as the services we are currently talking about? Well, it could be bits of the health and care system that are not particularly efficient. I mean, you know, most of it is valuable, let's be honest, but there are obviously bits and pieces
robbing Peter to pay Paul, essentially. You have to sort of take a bit from here and put it there.
Yes.
But essentially, I mean, because today you've said, look, it's absolutely at crisis point, and probably in another 6 months you'll come out and say something very similar, and in another 6 months there'll be something similar. What is it particularly that is worrying you about this time next year, for example, just in a line before we go?
Sure. I mean, I think, so you see where things are now. I mean, I can tell you now they will get worse. So we've got numbers. We have 700,000 older people who are going without support on an everyday basis, 25,000 without support in eating, 25,000. That number is going to increase. Now, that's actually a survival task.
Yes.
So we are talking about serious risks to health. So I think things could get a lot worse.
All right, thank you. Just to reiterate, that we have had a government response. Of course, Parliament's in recess, so we couldn't get anybody on, but they said we recognise the pressure of an ageing population, which is why, as we've already mentioned, we're giving local authorities access to £7.6 billion of new money for adult social care.